A BBC investigation has found that young victims of sexual assault are not being forensically examined in a critical time period at some privately run referral centres. Doctors say they have also seen incorrect recording of injuries and evidence contamination. Faye Kirkland, who's also a GP, has this report for us.
We've spoken to 8 doctors who wanted to blow the whistle on the poor care in some sexual assault referral centres run by private companies. One doctor who works across multiple centres and needs to remain anonymous says she's aware of 10 cases where young children weren't forensically examined within 3 days of being assaulted because the staff weren't available.
10 children missing out on forensic samples is quite a significant number. When you lose the forensics, that's something that you can't get back.
Probably a quarter of the statements I look at have something that concerns me.
Dr. Helena Thornton reviews evidence, typically including videos of genital examinations.
I have seen one DVD where gloves were not worn. I have seen one DVD which did not show the injuries that were documented to have been there. It's very distressing when to feel that somebody at their possibly most vulnerable ever, having been through a traumatic experience, has then been let down.
And do you think we're letting people down?
I do, yeah.
The first 3 days of forensics are crucial for young children. But 4 doctors have told us that in the last 2 years, they've seen cases of young children who've not been forensically examined within 72 hours because there's been no one who's been qualified to examine them. For 9 months, the Crown Prosecution Service refused to provide us with an audit of forensic evidence from a centre run by the company PrimeCare, produced in 2009. But the Information Commissioner has now ordered its release. All 13 cases went to court, but the audit reveals widespread failings. Only one provided acceptable documentation of injuries, and there were just 2 cases where the correct forensic samples were taken. In one instance where a victim was raped, no samples were taken from these areas. In a statement, the CPS said the centre fell short of standards, but following the report, they worked alongside the police to formulate an improvement plan. PrimeCare has since been incorporated into Allied Healthcare. It said the audit was historical and the centre was now run by a different provider.
I think it's absolutely terrible to read that report. I'm so shocked.
The Victims Commissioner now wants to see change.
I would like to see proper training, not just a 2-day training. And I think more importantly, though, we need to have annual inspections. If we're not being inspected and accredited, that doesn't give confidence for victims.
NHS England, who jointly commissions the services with police chiefs, said it had not been made aware of the concerns, but called on the doctors to report them to the Forensic Science Regulator. It now says it plans to set up a whistleblowing hotline for people with concerns. The CQC, the regulator for the healthcare, says it's now changed the way it inspects services, but we understand this still doesn't include reviewing the forensic medical evidence itself. Faye Kirkland, BBC News.